I'm Dr. Jennifer Keates-Baleeiro, and I'm one of the pediatric hematologist-oncologists that work at Children's at Erlanger. Children's Oncology Group is a national and international organization that's dedicated to taking care of pediatric patients that have oncologic conditions. And we work in cooperative trials to make sure that across the nation we have similar protocols for children with certain types of cancers. It's extremely important that we be part of a cooperative group so that we can share our information and data with one another so that we can have the best cures for our patients. When a patient is first diagnosed with pediatric cancer at our institution, we do look within the Children's Oncology Group to see whether or not there is, quote, an open protocol, something that might provide an opportunity for a new type of treatment or a new type of cure. There are also protocols that are available to patients for standard of care, and we choose to enroll as many patients as we can on trials that enable us to use new information. But if we don't have an open trial for a particular patient, then we go to the standard of care so that we can get the best for a particular diagnosis. So COG helps us to have access to different medications and different protocols that might not be available at most community hospitals. So it's important that we as a tertiary institution provide the best care for our patients. And if we cannot provide it here, we actually will find another institution for the child to go to in order to have state-of-the-art care. The point with Children's Oncology Group is to know that because we're working across the nation and also internationally to provide the best care, that becoming part of a trial actually enables us to gain information over time as to whether or not a new drug such as a monoclonal antibody might be better for a particular diagnosis, and that can increase our cure rates. If you look historically at leukemia in the 1970s, we only cured 2 out of 10 people, so 20%. Nowadays we're curing close to 95% for some types of pediatric leukemias. So if we didn't have the research to actually back up changing what we do, and we didn't have new drugs to actually use with kids to help increase their cure rate, we'd still be looking at pediatric cancer as a death sentence, which we don't. We actually look at it as an opportunity to cure. So I think that the amount of research that's been done in the last 50 years kind of proves that cooperative groups work and that it's important to be part of that particular COG status.